Good evening and welcome to Verdict. Tonight, 3 more dead of swine flu, the youngest to die so far, a 4-year-old child in Chennai and also 2 men in their 30s in Pune. Don't panic, says the government, but in Pune, sweeping measures, all schools, colleges, cinema halls have been shut. The health minister also addressed the media today. But on Verdict, we're looking at a slightly different angle. The government insists we shouldn't panic because the good news is that more children die of infant mortality than swine flu. Good news? Shouldn't we be looking at why so many children die in India and why there's no emergency response to that? Joining me for more tonight, Dr. V.M. Katoch, the Director General of the Indian Council of Medical Research. Also joining me in Delhi with me in the studios, Dr. M. Wali from the Ram Manohar Loya Hospital, Dr. Meera Shiva, Coordinator, the Initiative for Health, Equity and Society, Dr. Preeti Kumar, Public Health Specialist, and from Mumbai, Dr. Bajan of Hinduja Hospital, Mumbai. Thank you all very much for joining me tonight. Let's just look first at our top headline. Just some of the untold figures of India's health crisis. But let's just go across to a ground report from Munger in Bihar. Here, since July, 6 people have died of cerebral malaria. There are already 650 cases. Now, this is in just one area of Bihar. Let's just look at the story.
Ground zero of the cerebral malaria outbreak in Bihar. 6 deaths and 650 people affected, all within a block of 100 villages in Munger district. Gayatri Devi's 2-year-old daughter is the 5th of her family to get cerebral malaria. The others, including her 8-year-old son, were diagnosed at a private clinic 15 days ago.
जानते हैं सर, हमारा घर में 3 परिवार थे ना, तीनों में 6,000 रुपया लगा। ऐसे क्या? इस समय पहले यहाँ आते तो उतना नहीं लगता। हम लोग को ये सुविधा नहीं था। पहले नहीं था, इसलिए हम लोग को पैसा उतना खर्च हुआ।
तो ये सुविधा कब से हुई?
ये सुविधा इधर 8 दिन से हो रहा है, 15 दिन से।
A team of 5 doctors have worked non-stop for 10 days now, coping with scores of new cases each day. 8 doctors who had come from Delhi for assistance went back, saying things are getting back to normal. But these doctors are still struggling.
इसलिए कि देखिए ये दुर्गम क्षेत्र है, पहाड़ी इलाका है, वहाँ जाना थोड़ा कठिन है। बोलना बहुत आसान है, लेकिन जाना कठिन है। इसके बावजूद भी हम लोग जा रहे हैं वहाँ।
The good news is there are just 16 new cerebral malaria cases today, down from the 69 on Sunday, and none of them are severe.
The Bihar government says it will depute 2 more doctors here by tomorrow to cope with the rush. But questions will continue to be asked as to whether the government could have done more in terms of getting DDT sprayed on time and the like, so that things would not have come to such a pass. In the Haveli Kharakpur block of the Munger district, with Krishna Prasad and camera person Habib Ali, Alok Pandey for NDTV.
So our focus on Verdict tonight, health double standards. Has the swine flu outbreak and the government's emergency response exposed the laxity in dealing with other diseases? SMS India Space Yes or India Space No to 56388. 6388 if you're in the UAE or 63880 if you're in the UK. You can also log on to ndtv.com and cast your vote on Verdict. Well, I'm joined now by my special panel, and I'll go across first to Dr. Katoch, who's of course the Director General of the Indian Council of Medical Research, also Secretary in the Department of Medical Research. Really one of the key men who's looking at this virus, how it's actually reacting in different people. Dr. Katoch, first, before I broaden this discussion, just the news of today. 7 people have died so far. How much is that a source of worry for doctors like yourself and government officials? How does this change the government's response to swine flu?
See, all the deaths are unfortunate. I mean, I won't say that you can take the deaths non-seriously. Death is a serious issue actually, and certainly we feel bad about it. But you know, if you look at the totality of the situation, if in a influenza pandemic situations, these things do happen. And only thing is that people should have they should have actually, the response reaction should be not a panic one. You know what is happening. For example,
Yes.
This, because the virus is already a recombinant virus, which is with the 3-4 components, and we knew that we had anticipated that this will spread very fast, and that has happened actually. But India tried to contain it, and India did succeed for nearly 4 months actually to delay the process. by our screening, by our actually with the support of the cooperation of the people who reported to the systems, the secondary cases could be prevented by and large. I think that way it was a highly successful story in the initial part.
Yes, in the initial part you said, but we've suddenly seen in the last few days, well, I don't know if I can call it a spate, but we've seen 7 deaths in the last few days, and the differences between those who've died, a 4-year-old child, a 14-year-old child, then men in their 30s, in his early 40s, a woman in her 50s. Are there any high-risk groups specifically? Have you seen that pattern in these deaths so far?
I think I will not comment on individual cases, but I must assure you one part. You know, this, even if you say these two didn't have any predisposing reason, but the cases were reported quite late. You know, that one must remember that part also. The cases did not report to the system early enough. If you imagine now, you go take the positive side of 600-700 people who reported in time.
Yes.
Almost all could be. All were saved and everybody responded. Some responded slowly, but everybody responded.
Right.
So by and large, I think in a population where there will be some predisposing regions, some will be apparent. You know, like the uncontrolled diabetes or the respiratory infections, respiratory long-term problems, and steroids and other things going on. Those are known things, but many factors will not be known to us also, because that ultimately there's no time to investigate.
Right.
But most of the people have reported fairly late, you know, to for the treatment, when it's not their fault also. They had gone from one person to other, and those also they could not suspect actually they are suffering from that.
So early diagnosis, you're saying, is imperative. Let me bring in now Dr. M. Wali of Ram Manohar Loya Hospital. And Dr. Wali, let me say something which I think everybody who's been reporting the story and people who've been to government hospitals have said, that the government hospitals and doctors have done a superb job. It really is a superhuman effort. Everybody who has gone to these hospitals have said they have been treated well. What has it been like for you from Ram Manohar Loya Hospital? Has really been the epicenter of the treatment in Delhi. Can you describe to us what the situation is like for doctors who work night and day?
Right from the day one, when our health ministry took initiative, and it was especially a weekend many months ago, when there was a lesser spread of the disease, right from when the information broke from Mexico, our ministry took appropriate action, and within less than 24 hours, all the places were sensitized, so that and doctors were later on inducted into training programs, and the hospital was designated, started identifying cases, at least testing cases right from the day one.
Yes. And
the result of that is, when you find in the recent event deaths in Argentina as 337, deaths in Greece, a small country, 272, United States more than 350, fortunately this side of the story is very encouraging.
It's better than
that much less deaths so far. But now it's the test. The actual test is isolate, how efficiently we can isolate the infected people from the healthy people, and it all will depend on this isolation. The best thing to do to prevent this swine flu is isolate the infected person. Initially there were fears in the people that they will be quarantinized. Probably at that point of time,
and they didn't want to come to government hospitals.
The fear was, if I declare I am having flu-like symptoms, when I land up in Delhi or Bombay, I'll be quarantinized. So people hid their symptoms, and there was a episode in which we had to retrieve that person who absconded. I would use the word, technically absconded, with all due respects to him. And then I would say one thing which would highlight the arrangements is, so far no one has been denied to come to the hospital saying we are crowded. No one has been denied the right to get properly examined by a clinician. No one has been denied to be tested if needed, and no one has been denied for giving efficient treatment, whether it is a contact or the patient.
So that's a record you can truly be proud of. And Dr. Shiva, let me bring you in on this point. And of course, the other aspect is that we know that all this is free, it's funded.